Welcome back. There are certain conditions and diseases that make people more susceptible to wounds. It's not always the result of a fall or an accident, for example. And joining us now to chat about their specialty wound care clinic at SAAK Health is Dr. Priya Asija. So great to see you again.
Thank you for having me here.
Thanks for being here. I want to talk first just about the fact that I visited you at your new beautiful facility. It was really good to see what you do there. And one of the things that's so impressive to me is how easy it is for people to see a specialist like you. The parking is easy. It's easy to get into the center. All of those things I think really mean a lot when you're sick or you've got some type of injury and you come to see a specialist like you.
Yes, accessibility was our motto. So we wanted people not to wait in line, go to a parking structure, come back and then see us, which will take an hour. But for our facility, it's only a few minutes that you can come in, see us, and you're out the door.
It's amazing. And we're looking at video now of this, doctor, where you can actually do surgery on the premises, which is unbelievable. You can see your practitioner for an evaluation or pre-op visit. The other thing is that you have this specialized wound care. And I know that's where you come in and why you're so important to the team at SAAK Health. Let's talk first about wounds, because a lot of people aren't familiar with maybe the scope of what causes them. So in most cases, what is the cause of a wound?
The causes of wound can be varied. It is likely due to poor circulation, diabetes, trauma, post-surgical wounds, and also radiation injuries and burns.
I forget about radiation. So you mean like cancer treatment?
Yes, ma'am.
Okay, because I know the skin can be affected there. What about the diagnosis of wounds that maybe don't resolve or they don't heal? Because that's where it seems like they get a little bit more critical, is when they become chronic.
So we classify chronic wounds as a wound that is not going to be healed after 4 to 12 weeks. That's the criteria for calling it a chronic wound. So the diagnostic modalities which can help us would be first of all looking at the wound, then imaging, then also doing vascular studies, and also finding the cause. Is it diabetes? Is it trauma? Is it a pressure ulcer? That can help.
Imaging is something I'm not familiar with as it relates to diagnosing a wound. So those images will help tell you sort of what's underlying?
Yeah, we have ultrasounds which can diagnose as venous insufficiency. Is the vein competent enough to diagnose the reason for this venous insufficiency? Or we can do arterial brachial index, which we call as ABIs, which can help us to diagnose if there is enough arterial blood supply to that organ. But with that said, we do not only have the diagnosis, but we have the capacity to treat these wounds here. So we have a vascular team in our clinic, and it's a one-stop shop where we can put stents in, do diagnostic angiography and catheterization to help this.
I love that you have all of that right there on the facility. And one of the things I know you're super excited about, because we talked about it when I was visiting you, is the hyperbaric chamber. I mean, to have your own hyperbaric chamber on the premises has got to be very unusual.
Yep, we have not one, but 2 hyperbaric chambers. These are the state-of-art hyperbaric chambers which we are going to use for patients who have chronic wounds, especially diabetic foot ulcers, trauma, radiation, post-surgical flaps which are not healing, the other drowning, air embolism. These are the indications, but there are non-FDA indications for chronic hyperbaric chambers too, and that could be post athletic recovery, deafness, and sudden vision loss.
Wow, all of those things can be helped with a hyperbaric chamber. One of the things I wanted to just quickly address is the stigma, because I feel like very often wounds are probably unsightly, and maybe people are embarrassed to even talk to their doctor about a wound that won't heal, or something that might even be obvious if you're socializing or among people. Is that part of what you deal with in your practice?
Yes, unfortunately, yes. There is a stigma associated with chronic wounds, because they are not good to look at, they smell, the patient feels embarrassed to go out, and I feel there is a sense of abandonment by us as medical providers for these patients. So I want to bring wound care to forefront at SAAK Health so that we can take care of these patients.
That's what I love about you. I know that you're so aware of the stigma because you talk to these patients daily, and the fact that you went into this specialty, it's such a gift to your patients and the people who see you. Thank you so much for being here, and congratulations on the beautiful clinic and the great work that you're doing.
Thank you for having me.
Really appreciate it. And not all wounds are the same. You can visit SAAK Health for personalized treatment. They hope to remove that stigma that's associated with wounds and wound care. For more information or to book an appointment, they have a beautiful facility that's easy to access. Call 262-444-5148 or visit SAAK, it's SAAK, SAAKhealth.com.